Hospitals are supposed to be sanctuaries of healing, staffed by dedicated professionals sworn to protect and save lives. But what happens when the very people trusted with our most vulnerable moments turn out to be cold-blooded predators? Today, we are examining 5 of the most prolific and terrifying medical serial killers in history, individuals known as angels of death who exploited their positions of power to quietly and systematically murder their own patients. Number 5, the lethal nurse, Janine Jones. During the late 1970s and early 1980s, pediatric nurse Janine Jones worked in a clinic and hospital in Texas, where a suspiciously high number of infants began experiencing sudden, unexplained respiratory and cardiac emergencies. Jones thrived on the adrenaline and the attention of the resulting medical crises. She would intentionally inject babies and young children with powerful paralytic drugs or anticoagulants, just so she could be the hero who stepped in to save them. Unfortunately, her sick hero complex often proved fatal, and several infants tragically died under her care. The hospital administrators, fearing massive liability and a public relations nightmare, quietly asked her to resign instead of reporting her to the police. She then moved to a pediatrician's clinic where the alarming pattern continued. She was finally caught and convicted for the murder of 15-month-old Chelsea McClellan, but investigators believe the true number of her tiny victims could be as high as 60. Number 4, the Cincinnati Angel of Death, Donald Harvey. Working as a hospital orderly in Ohio and Kentucky during the 1970s and 80s, Donald Harvey considered himself a merciful executioner, claiming he killed patients to end their suffering. However, his definition of suffering was terrifyingly broad, and he often targeted patients who had simply annoyed him or caused him extra work. Harvey was a highly resourceful killer, using a variety of undetectable methods, including mixing arsenic and cyanide into patients' feeding tubes, suffocating them with plastic bags, or injecting lethal doses of insulin. He managed to evade detection for nearly 2 decades. His horrific killing spree only ended in 1987 when a sharp-eyed medical examiner smelled the distinct odor of almonds, a classic sign of cyanide poisoning, during an autopsy. Harvey eventually confessed to 87 murders, cementing his legacy as one of the most prolific serial killers in American history. Number 3, the lethal nurse, Charles Cullen. Over a 16-year nursing career across 9 different hospitals in New Jersey and Pennsylvania, Charles Cullen quietly moved from facility to facility, leaving a massive trail of bodies in his wake. Cullen exploited the chaotic environment of intensive care units, sneaking into patients' rooms and injecting their 4 bags with lethal, unprescribed doses of digoxin and insulin. Astonishingly, many of the hospitals suspected him of harming patients, but due to a severe lack of communication between institutions and a deep fear of lawsuits, he was repeatedly allowed to resign and quietly find work elsewhere. It wasn't until a brave colleague, Nurse Amy Luffren, collaborated with detectives and wore a hidden wire that Cullen finally confessed. He pled guilty to 29 murders, but experts believe he may be responsible for over 400 deaths, making him potentially the most prolific serial killer in U.S. history. Number 2, the terrifying case of Niels Hogel. In the early 2000s, German nurse Niels Hogel sought the thrill of resuscitation and the admiration of his colleagues. Working in intensive care units in Oldenburg and Delmenhorst, Hogel deliberately injected critically ill patients with massive overdoses of cardiovascular medication to induce cardiac arrest. He would then jump into action, attempting to revive them. When he succeeded, he played the hero. When he failed, the deaths were simply attributed to the patient's already severe illnesses. The staggering spike in mortality rates during his shifts eventually aroused suspicion, and he was caught by a colleague while preparing to inject a patient. Following his arrest, a massive investigation involving the exhumation of over 130 bodies revealed the true, horrific scale of his crimes. In 2019, Hogel was convicted of 85 counts of murder, the largest number of killings attributed to a single person in Germany since World War II. Number 1, the most deadly doctor in history, Harold Shipman. Operating as a highly respected, deeply trusted general practitioner in Hyde, Greater Manchester, Dr. Harold Shipman was a pillar of his local community. His patients loved him, completely unaware that he was systematically murdering them. Shipman typically targeted elderly, vulnerable women who lived alone. During routine house calls, he would inject them with massive, lethal doses of diamorphine, a medical-grade heroin. He would then falsify their medical records to make it appear as though their deaths were the natural result of poor health, and then calmly sign their death certificates himself. His arrogance was ultimately his downfall. In 1998, he crudely forged the will of his final victim, an 81-year-old former mayor, leaving her entire massive estate to himself. The victim's daughter, a lawyer, immediately suspected foul play and contacted the police. Following an exhumation and a massive public inquiry, it was determined that the beloved Dr. Shipman had murdered an estimated 250 of his own patients over a 23-year period.